Okay, this is one of those cases that as a doctor we learn to laugh at, but it gets kind of frustrating. The lesson I have learned with this sugar glider is that communication with your doctor is really, 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 really important.
I call.
Yeah, no, we've talked a few times on the phone. Unfortunately, we've been talking with so many other doctors and so many other people that it gets kind of confusing. So anyway, with this in mind, this guy was actually a really cool case. He came to us about 2 weeks ago?
Couple weeks, about 3 weeks.
3 weeks ago? Okay, 3 weeks ago.
22nd.
He had a tail that looked more like beef jerky. Then it looked like an actual sugar glider tail. So we did a cytology. We actually scraped the little area right there. Put it under the microscope. Under the microscope, we actually saw a mixed infection, both bacterial and fungal. Again, we don't see a lot of those kind of cases in these guys. So it was kind of strange. You send him home on an antifungal and an antibiotic. It seemed to make a little bit of a difference in the beginning, but the infection was still ascending. Oh yeah, get her. Bite her for me too.
Oh, you're so sweet.
Anyway, so the infection was climbing. It wasn't getting any better. So at that point in time, we actually went ahead and amputated the tail, hence that short little nub that he has there. I have had several conversations with the hand that you're looking at right there. Since this is a channel only for animals, we don't show any humans on here because humans are evil. I expected more laughter with the 4 ladies that were in this room, but that's as good as it's going to get, I can tell.
Is that where the other glider bit you? Is on that finger?
Yeah.
Or somewhere?
Right in there.
That's what he's going after, and he can probably
No,
do
no,
it.
it's that one. He's
Yeah.
going after the
You want to see what the picture on the video?
Oh no, that's I mean, this guy just did more damage than.
Ouch. In the cuticle. Has a mean shot.
I don't know.
Okay. So anyway, our buddy here ended up getting his tail amputated. He actually has some complications today. He had a small abscess at the base. The good news is it looks like it's still doing some healing. Whoa, no jumping. Yes, we addressed his ears last time, did cytologies. All we saw was debris on the cytologies. Today, we're actually having a mixed infection of both bacteria and fungi. The cellularity of the ears are much different than the cellularity of the small abscess at the base of the tail. I did take punches of pictures, so I'm going to add them to this video as well. Anyway, so today we're going to start again on a different antibiotic and continue a higher dose of an antifungal, and hopefully that makes all the difference in the world for this guy. Despite his chronic ailments, he really is pretty spunky. What's up, dude? Hey, what's up?
His name is Rambo.
We don't say their names on here. They could be wanted. There may be some female sugar glider stalker out there that wants to follow this guy.
You're gonna have my baby.
See?
You're gonna have my tail.
We have one already. You can hear in the background.
They are not going to have his babies. He is an inbred baby. He will not be having babies.
So anyway, first blood here is not named Rambo. Anyway, we're going to try a different treatment. Hopefully by this time in 2-3 days, he will look like a whole new sugar glider. Mom will be happy with me. We even have dignitaries from out of state. Wait a minute, while we're plugging stuff. The Sugar Glider Guardians. All right, they're on Facebook.
Thank you.
You, that's what you wanted? All right. Don't go over the edge. Yeah, this card. How's that for awesomeness?
Yeah.
Follow them on Facebook. You don't have a YouTube channel or anything on Twitter or nothing like that? No.
Facebook.
Just Facebook. All right. And for you guys that are looking for someone to stalk, she's not too bad on the eyes either, so go check her out.
Her husband is awesome. He loves them just as much as she does.
Hey, be quiet. That gives us more
That's
followers.
funny. Yeah, exactly. Sex sells. All right. That's enough for this case. Later. Okay. This case also exhibits the need for a cytology versus just a culture and sensitivity. For example, had just a culture and sensitivity been done, this animal would have gotten a result back that said that blankety blank bacteria was responsive to blankety blank antibiotics, and then of course he would change it to whatever was appropriate for a sugar glider or whatever species was involved. The bad news is most culturing labs will not grow the fungi that's on there and might not even mention that there was a fungi on the slide. Also in the process, we would not be treating a fungal infection for more than a week, depending on how long it takes the culture results to get back. So cytologies are awesome. I love my microscope. As you can see right there, there's this large fungal rod there, and on the sides you can actually see, not particularly this one, there's a large fungal thing right there in the center. But anyway, I guess the point I'm trying to make is, had we just banked on the cytology for this case, we probably would have barely fixed 50% of what was happening. And this creature's tail was already less than half an inch long. Ears were already starting to show some necrosis. And, with that in mind, we would have definitely done a disservice for this patient. So anyway, with the advent of having a cytology, we now know that we have a mixed infection still. So we've doubled the dose of the antifungals. We've already switched to a different antibiotic pending the culture results that'll come back. And again, that could be a week, 2 weeks, or a few days. The way cultures work is they put the organism on a slide. They then grow it. Once it covers the slide enough where they can actually put separate doses of anesthetic discs on it, then they have to wait another day or two to see exactly how well those antibiotic discs kill the bacteria, and then they report back to us as to what would work. Anyway, so we waited on that. That could be a week, depending on how long it took them, or longer. If this were a TB case, it may take them months to grow that much organism to figure out which drug worked best. All right, that's it for now.